Hello students, welcome to the session Most Important MCQs for INI CET examination for the subject Public Health Dentistry, and I am your faculty for Public Health Dentistry, Dr. Shilpa. I've compiled 10 most important MCQs from the previously aired asked questions of the INI CET examinations, and we'll discuss each of it one by one. So the first question is, CPI-TN index is used for. So is it determining treatment needs or determining caries? Choice C, determining fluorosis or determining malalignment of teeth. So what is the full form of CPI-TN? The full form of CPI-TN is Community Periodontal Index of treatment needs. So when we see the full form, we know that of course choice A is the right answer. To see few indices determining caries, you have DMFT index for the permanent dentition, DEF index for the primary dentition. You have Dean's fluorosis index to determine fluorosis levels, and indices to determine malocclusion. You have dental aesthetic index, you have index of orthodontic treatment needs, etc. To look into CPI-TN very briefly, so Community Periodontal Index of Treatment Needs was developed by the Joint Working Committee of the World Health Organization and also Federation Dentaire International in 1982. And the authors are Jukka Ainamo, David Barnes, George Beagrie, Terry Cutres, Jean Martin, and Jennifer Sardo Inferi. Also, CPI-TN can be used in epidemiological surveys as well as in a modified form by individual dental practitioners. So, in epidemiological surveys, it can be used on the population, or by individual dental practitioners, it can be used on the individual. So, in the individual, it's a modified form for screening and monitoring the periodontal status. So, that is about Community Periodontal Index of Treatment Needs. Now we come to the next question. Match the following. So you have column A and column B. Column A terms are Knudsen, Muller's, 1.23% APF and Durafat. So you have to match with the appropriate terms in the column B. So if we see Knudsen, of course, sodium fluoride is the solution used in Knudsen's technique. Muller's, stannous fluoride is used. 1.23% APF gel, the parts per million of fluoride is 12,300, and Durafat is a fluoride varnish. So A1, B2, C4 and D3. So the choice A is the right answer. So to look into little more details about the terminologies here, in Knudsen's technique, we use 2% sodium fluoride, and in Muller's technique, stannous fluoride is used. APF gel contains 1.23%. APF gel contains 12,300 ppm of fluoride. And Durafat is a fluoride varnish. So, what is the method of preparation of sodium fluoride in Knutson's technique? So, 2% sodium fluoride is made by dissolving 20 gram of sodium fluoride in 1 liter of water. Next, the recommended applications are 4 applications of sodium fluoride, weekly intervals for a year, and the recommended age groups are 3, 7, 11 and 13 years. Next, we come to the method of preparation of APF, 1.23% APF. 1.23% APF aqueous solution is prepared by dissolving 20 gram of sodium fluoride in 1 liter of 0.1 molar phosphoric acid, and to this 50% hydrofluoric acid is added to adjust the pH at 3 and the fluoride ion concentration at 1.23%. So it is also called as Brody-Wold solution. Coming to Muller's technique. Here, stannous fluoride is used and it is a paint-on technique. And the solution is allowed to dry after application for 4 minutes. And repeat applications are made every 6 months. That is biannually. And more frequently if the patient is more susceptible to caries. Durafat, it is a fluoride varnish which was first developed in Germany, and it is a viscous yellowish material containing 22,600 ppm fluoride. So Durafat has shown caries reduction of 30% to 40% in the permanent dentition and 7% to 44% in the primary dentition. So that is about the fluoride concentrations. Now we come to our next question. Prisma is used for. So to see the full form of Prisma, preferred reporting items for systematic reviews and meta-analysis. So the choices given here are cohort study, cross-sectional study, RCT and systematic reviews. So when we see the full form, preferred reporting items for systematic reviews and meta-analysis, we know that the right choice is D. For RCT, The checklist for quality assessment is consort guidelines, and for cohort study and cross-sectional study, it is the strobe guidelines. So these are checklists for quality assessments of the study designs. Coming to the next question. Panel study is a type of, is it a cross-sectional study, is it a longitudinal study, or a quasi-experimental trial, or a randomized controlled trial? So panel study is conducted repeatedly for a long period of time. So when you see it is over a period of time, we know it is a longitudinal study. So it is a particular design of longitudinal study. Panel studies are a particular design of longitudinal study. So here the unit of analysis is followed up at specified intervals. Followed up at specified intervals over a long period of time. Over long period of time. So it is almost many years. So the key feature of panel study is that they collect repeated measures. They collect repeated measures from the same sample at different points of time. So they are longitudinal studies. They are conducted for a long period of time, over many years. They are followed up, and repeated measures are collected from the same sample at different points of time. Coming to our next question. Sharp and metallic waste is discarded in which bag? Is it blue or white bag, or red bag, or black bag, or yellow bag? So what are sharps? Sharps constitute needles, syringes, scalpel blades, glassware, and metals like implants. So if we see the color coding for the disposal of this category of waste, yellow is for infectious waste mostly. Black bags is mostly for recyclable, non-infected general waste. And red bag is mostly for the contaminated plastic waste, tubings, bottles, etc. So the right answer is A, blue or white puncture-proof container. So we'll see it again. Blue or white bags is for disposing sharps. Red bag is for disposing contaminated. And another important word is recyclable waste like tubings, bottles, IV tubes, catheters, etc. Yellow bag is used for human anatomical waste or animal anatomical waste, soil waste, infectious waste, etc. Infected with blood, etc. Black bags are used for disposing general, non-infected, recyclable waste. Recyclable waste. So coming to our next question. In the 5 hours of smoking cessation, what is the correct sequence of the following? So of course the sequence is jumbled up. So let's see. We can see that reward, relevance, repetition, risk and roadblocks are given. And we know they are jumbled up. Which is the correct sequence? The choice A to choice C has relevance in the end. Choice D has repetition in the end and relevance in the beginning. So it makes sense that we speak about relevance, then the risk, about the rewards, roadblock, and then we repeat it. So the right answer is choice D. We look into the 5 R's. So the first R is relevance of quitting. So we encourage the patient to indicate why quitting is personally relevant. The second R is risk of continued tobacco use. Risk of continued use. So ask the patient to identify potential negative complications, negative consequences of tobacco use. Then the rewards of quitting. Ask the patient to identify potential benefits of tobacco use. The fourth R is roadblocks. The roadblocks to quitting has to be identified. The barriers have to be identified by the patient, which are the impediments to quitting. And the fifth R is repeat this at each visit. Repetition. So the motivational intervention should be repeated every time to the unmotivated patient, and whoever have a relapse, you can always go through the same cycle of 5 A's and 5 R's, and the counseling is a continuous process. So to see the 5 A's, also I'll mention here. Ask, advise, assess, assist and arrange. Next we come to the next question, that is, under National Oral Health Program, planning to place dentists is at which level? So is it a urban primary health center, health and wellness, or community health center, or primary health center? So the current situation is that there are not much dentists in the rural areas because they are more concentrated in the urban areas. So that is why the right answer will be choice D, primary health center, because a proposed plan is of placing no less than a single dentist per PHC to cover a population of 30,000. So in the public health scenario, the public health practitioner always sees oral health as a mirror of general health. It's considered to be an integral part of general health. Integral part of general health. So the health programs which are already in place, the national health programs, the oral health programs have to be integrated with these programs. And Also, there are a significant number of people who have no access to permanent access to dental services. They are not accessible or accessible or they are not near to these, they are in the hilly areas maybe. So the availability or accessibility may not be there, and the treatment or the provision of healthcare delivery is compromised at many levels. And the primary oral healthcare approach involves oral health promotion, favors health equity, that is, based on the need, the resources will be distributed, or the treatment or the benefits will be made available, and risk assessment, preventive interventions, including communication, and interprofessional collaborative practice. Interprofessional collaborative practice. Because as I told, oral health is considered as an integral part of general health. So we come to our next question now. The amount of time that has lapsed between the initial exposure of disease and its detection is called as. So is it generation time? Is it median incubation period, or latent period, or incubation period? So we are talking about the amount of time that is being termed here. And the time lapse has to be told between the initial exposure of the disease and the time of its detection. So initial exposure time, it is not detected. There is a time lag for its detection. So that time is called as choice C, or the latent period. So what is latent period? Latent period, also known as latency period or pre-infectious period. Pre-infectious period is the time interval between when an individual or host is infected to the time when the individual becomes infectious, that is capable of transmitting pathogens. So that is the latent period. Now we'll see what is generation time. Generation time is the time of an infectious disease between the beginning of infection to the time the person transmits it to another individual. So beginning of infection in an individual who can be called as an infector to the time the person transmits it to another individual who is called as the infectee. So that is generation time. What is incubation period? It is a time from the time of invasion of the pathogen in the host time of invasion of the pathogen in the host, to the time of onset or the first appearance of signs and symptoms. That is called as incubation period. Now we come to our next question. There were 120 cases of lung cancer, among whom 24 were smokers. So we draw our 2 by 2 table. For the column, we write people who had lung cancer and no lung cancer. And in the rows, we mention the exposures, that is smoking present and non-smokers. So students, please remember how we mark our rows and columns. The disease present or absent, disease present or disease absent we mark in the columns, and exposure present or absent we mark in the rows. So exposure present disease present becomes A, exposure present disease absent becomes B, exposure absent disease present becomes C, and exposure absent disease absent becomes D. So here, according to the question, there were 120 cases of lung cancer. So that means disease present is 120. 24 were smokers. So A is 24. 1000 cases did not have lung cancer. So B plus D is 1000. And 40 were smokers. So B is 40. So that means 120 minus 24, 96 is C, and 1000 minus 40, that is 960 is D. So coming to back to the question, find out the odds ratio. What is odds ratio? Odds ratio is a measure of the strength of association between the risk factor and the outcome. Between the risk factor and the outcome. And the formula for odds ratio is AD by BC. AD by BC. Formula for odds ratio is AD by BC. So our odds ratio will be 24 into 960 by 40 into 96, which is 6. So the right answer here is A. Coming to our next question. Which of the following study showed that there is increase in caries rate with increase in dietary sugar consumption? So this question is based on our dietary studies section. So is it choice A, Hopwood House study, or choice B, is it Wycombe study, or choice C, Turku sugar study, or choice D, Tristan da Cunha study? So if you see Tristan da Cunha study, this study was done in the island of Tristan da Cunha, and it was done on the enclosed communities who happened to migrate to the west and then came back and settled. So there was a difference in the caries experienced due to the change in the dietary patterns. So that means the choice is not D. Coming to Turku sugar study. Turku sugar study was done to compare the karyogenicity of sucrose, fructose and xylitol. So that means the right choice is not choice C also. Coming to Wipe Home Study and Hopewood House Study, right? Hopewood House Study was done. Hopewood House Study was done to assess the dental status of children between 7 to 14 years of age residing at Hopewood House. This was done in New South Wales. So this was conducted longitudinally for 10 years. So that means the right choice is choice B, that is Wipe Home Study. So coming to Wipe Home Study, described by Gustafsson et al. It was a 5-year investigation of 436 adult inmates of Vipum Hospital. This was in Sweden, in an institution for mentally challenged. So this study showed that there is an increase in caries rate. There is an increase in caries rate with increased dietary sugar consumption. And we'll also look into the purpose of the study. The purpose of Vipum study, it was to find out, does an increase in carbohydrate, that is mostly sugar, does it cause an increase in dental caries? And if so, is a caries activity influenced by ingestion of meals in a refined sugar, in a non-sticky form, or in a sticky form, or in between meals? Or does a decrease in sugar intake or the carbohydrate intake, does it decrease dental caries? So the conclusions showed that increase in sugar consumption caused an increase in caries experience. So that was about this session. We discussed 10 most important PYQs for the INI CET examination. Thank you.